Welcome to WEDI Quick Hits. I'm Michael McNutt, Director of Education and Events for WEDI. Recently, the Caring Alliance, the Department of Health and Human Services Next Gen External User Management System Team, the Office of the National Coordinator for Health Information Technology, and the Centers for Medicare and Medicaid Services partnered to lead a public-private sector effort to develop a digital identity federation proof of concept. The recommendations in this report are provided as a means to build on the work that's already occurred and define how the healthcare system can move toward an interoperable, equitable, resilient, and secure federated digital identity ecosystem in which trustworthy API-based exchange can be executed. In May, WEDI welcomes a panel of subject matter experts moderated by Ryan Howells from the Caring Alliance to offer the audience lessons learned, best practices, and next steps on how the industry can move forward with a fully interoperable, voluntary, federated digital identity ecosystem in healthcare. To offer further information on the digital identity evolution and revolution and what it means to the industry, I welcome John Kelly, former principal business advisor with EdFX and a former board member with WEDI. Welcome, John. You are a big proponent of digital ID, so I'm sure the news of this proof of concept paper was music to your ears. What are the finer points of the POC paper from Caring, and why is this so important to the industry?
Well, I think, as a very wise mentor of mine years ago told me about healthcare technology and HIT, this is a rock in the air. It's going to hit the ground, right? So I think what's important for anybody who's listening to grasp about this white paper is that this is going to happen, and it's going to happen either with them, around them, or to them. And so this white paper that Caring has been working on and developing for a while is very complete, very comprehensive. It has a very solid, understandable problem statement. Perhaps the most important thing about this white paper is the fact that it's sponsored by ONC and CMS as partners, real partners in the proof of concept. And it is indeed a real proof of the concept in production. And if you want no more real evidence of that, as you said, I am former board member, former principal business advisor. I recently retired, recently had to sign up for Medicare, and was able to go on. And lo and behold, I was offered the option to use ID.me, an identity broker, a commercial identity broker that's recognized by the government as providing adequate identity management for me to justify that I am who I am to the federal government for entitlement programs. And so the idea that they're using it, that people like Carnival Cruise Lines, that the NFL, the NBA, most of the banks in America are now doing identity management this way, allowing third-party people to say, you are who you say you are, issue you a credential, walk around with it, and then use that credential anywhere, the same way you would use a passport or a driver's license with anybody. There are a number of states who started using digital identities as driver's licenses. So you have an option of having your old-fashioned physical driver's license, or you can walk around with a digital credential in your phone that'll say you are who you say you are. And this is really a critical issue in healthcare. And I think, perhaps the last point that I'll say on why this is important is we have been spending tens, maybe hundreds of millions of dollars over the last 10 or 15 years chasing the concept of patient matching. This is a whole new way to look at how patients are matched, how you can comfortably say that I'm taking this information from this person with this name, merging it with this information in my system already with a person of the same name, and being confident that that information belongs together. That this white paper, I think, is the first step in putting to bed the idea that we need this very complicated algorithm-based infrastructure that only gets you to 99.6 digits with room for probable error that we've been struggling with and spending lots of money on for years.
Now, you referenced the other industries that have embraced digital identity for some time: tourism, sporting events, state governments with driver's license. What's been the holdup with healthcare?
Well, I think like with a lot of things in healthcare, it maybe falls into three buckets. Maybe first and foremost is vested interest in the status quo, right? There are a lot of companies, people, vendors working with large institutions who invested a huge amount of money in the traditional methods of patient matching. And they're reticent to change. Let's face it. They talk about why it's hard to cut costs in healthcare. It's 17% of the GDP. That means a lot of people making a lot of money off of it. So I think, there's that fundamental issue that always occurs in healthcare where invested interest in the status quo is a barrier to entry for new technology. I think, on a more kind of embraceable issue, there's legitimate failure to trust the technology. When you merge information in other systems, bad things can happen, but people don't die, right? At the end of the day, if you miss or add an allergy or some such, contraindicated medicine or something, you can make a decision based on bad information, and people are liable for that. So there's legitimate concern. And it exists today. We see in interoperability that a lot of people are still reticent to merge payer data with provider data, or provider data with provider data, or patient-reported outcomes with EMR data, right? Because they're just so worried about the liability involved. But with a digital identity, you put the liability and the responsibility and also the credibility on the patient themselves. The patient saying to you, this is my information, you can put it with my other information. You're not relying on some algorithm or some third-party method to say, I think this is right, so let's go ahead. Let's merge the data. Or I'm not so sure, so let's not. The patient is asserting to you, yes, it's my data. Put it all together.
Now, you've mentioned the importance and the benefits earlier, and we're talking about kind of these barriers as to why healthcare hasn't jumped it. But now let's kind of move forward and say, now it's application time. What if any, are the challenges that the industry must consider when developing this ecosystem?
Well, I think, again, like some other issues in healthcare, we have moral and ethical responsibilities to take care of the whole part of the population. And with a lot of healthcare technology we've seen over the last 5-10 years, certainly WEDI sees it in feedback on conferences, on the things that we propose, that, people, consumer advocates raise the question, well, not everybody has a cell phone, or not everybody's got a digital footprint, or not everybody can be part of this new solution. So, there's, for some reason in healthcare, unlike a lot of other industries, we're not okay with, well, if it doesn't work for all, we can't do it for any, right? When you look at the Medicare, Medicaid example, CMS is now embracing this technology. If you want to sign up, they make it a whole lot easier for 80 or 90% of the people to move forward, get enrolled quickly. Use myself as an example. When I went through this process, enrolled myself, I was enrolled within 10 days. I had a card in the mail, right? Without having to call anybody, talk to anybody, wait on hold, do anything. That's a good thing. Now, they still have to have offices open. They still have to have phone banks. They still have to have people that can call in if you don't have a digital footprint. But I think, the idea that continues to be expressed, a lot of healthcare technology, that, well, it's not working for that part of the population, so we have to think twice about whether we employ it. I think those are difficult populations to deal with anyway. They need targeted programs. They deserve, and we have a moral obligation, ethical obligation to create ways to get to them. That doesn't mean we should not embrace this new technology to help the 80 to 90% of the people that can benefit immediately.
No, makes perfect sense. John, it's always a pleasure to pick your brain for a couple of minutes. Once again, the Caring Alliance panel session on digital identity will take place during WEDI's Spring Virtual Conference, taking place May 22nd through the 24th on Zoom. Register today at wedi.org. Thank you for joining us, and be safe.
Thank you, Michael. Take care. Have a great day.